Hello, dear colleagues. How are you? I hope you're okay. And we have a patient number 5, Jen. I think it's a lady. Yes, young lady, just 45 years old, 44 years old, with the multiple aneurysms after subarachnoid hemorrhage, and she has 4 aneurysms, one on ACOM segment, nearly 3.5 millimeter, paraclinoid on the right side, 2 millimeter, and 3.5 millimeter on the PCOM segment. Just a second. And we did a rotational angiography, also vertebrovascular system, and left carotid also, and on the left carotid one more ophthalmic aneurysm. This aneurysm is nearly 5 millimeter in length and 3 millimeter in width. Okay, можно вот этот экран. Okay, and now you can see this is from the right side, one aneurysm, 2 aneurysms. There is a paraclinoid invisible aneurysm and good PCOM. And yes, it might be candidate for flow diversion, and the left side is just coiling, and the right side might be FD, and the ACOM is for the balloon assistance. And it was some suspect for one more aneurysm in left PCA, but Abzal did a 3D rotational, and it's just a angulation of the left PCA. It's normal. It's finally 4 aneurysms, and little question about this segment, but it's look like just a PCOM segment, yes, ACOM segment, and this is an only aneurysm. We have 1, 2, 3 aneurysms on the right side and 1 aneurysm on the left side, and rupture was from the PCOM aneurysm, which is 3.8 millimeter, and ACOM is 3.6 millimeter, 3.5. I think the first coil will be 3 millimeter for the ACOM. We are planning to do balloon assist coiling, and for the paraclinoid aneurysm, I'm not sure should we do this or just plan for the stenting with braided stent. Let's see. There are 2 bulbs, and it's quite interesting situation. Okay, let's start. I asked Abzal to take 8 French guiding, which is Hyperion right coronary guiding, Judkins right 4-0, and then he took a headway 17 with 90-degree angulation and Chicago black, and scepter 415 for balloon assistance. Maybe this time we will do 3 aneurysms, which is bigger, and the paraclinoid smaller one we will leave for the next time, just to place a Leoplast stent or flow diverter in this segment. And this aneurysm is partially calcified. Так, маған наоборот андай бұрвай коннектор бере сал, мынавай коннекторды ала сал. Қазір бір секунд. Yeah, мынаны біреуін бере сал. Okay, we need this Y connector. Just a second. Be careful. Take this one. And this one. Ой, бля. Иди. На наш, пожалуйста. Ультражирсу. This 2 bolt Y connectors is more suitable because of this angulation. It's better to take this than to take another one. I'm not sure this imaging will be suitable for the treatment, but we'll try to take 3 screens. Так, дай на adjustment. Okay. Abzal took a 3-way stopcock with a 5cc syringe, 60%, 70% of contrast. Now we're just taking balloon like this and inflating, and we need to push the 70% contrast through the dead space, and now it's inflated. It's very important. If you remember from the last time, during the deflation my balloon went out from the saline, and the half of the balloon was with the air bubbles, and today I need to keep my eyes on the balloon tip, and till the complete deflation I will wait. It's very important. Last time it was my mistake, but fortunately the treatment ended without any complication, and today I hope it will be the same. I deflated the balloon completely, 70% of contrast. Yes, first of all we will put, just a second, es ist nicht it was not flashing. Just a second. There is air bubbles. Та біреу наштасыр. Чекай блок біреу наштасыр. Okay, I'm asking for the second Chikai black. Yes, for navigation of scepters, sometimes Traxxas is better. It's more
Chikai black.
It's more controllable. Yes, and as you noticed, I'm becoming older and older. My eyes are tired, that's why I need to do like this. I need to check my eyes for lens, and I hope everything will be okay. Because of radiation, because of a lot of flying, it might be some problem. I think it's expected. Okay, I will put it here and then put it here. 3 мм спираль бересеңізші. Optima дұрыс болады ғой. 3/10 бере беріңіз. Okay, maybe we need to start from the ruptured one, but I think if its navigation is okay, we will first start from ACOM and then we'll go down to the PCOM. It's more comfortable option. Is that? Okay, I'm still on vacation, and how the vacation looks like in my situation. This is vacation day number 15 or 16. Yes, I took my vacation before the Pairs Nero, and it's continuing. And thinking about to change my working place from Astana. Maybe something new and something special. Let's see. On May 5 it will be more clear where I will continue my career. Yeah? Okay, let's see what kind of coils we have. 3x6, 3x6. Ана отделялкасын бересіңізші. Новый болса, новый. Екеуін де ашсаңыз. Екі новый ашсаңыз. А есть. Кім ая отыр? Бәрі пациенттер үшін. Бәрі пациенттер үшін. Everything for the patients, and the lateral position is looks like okay. Yeah, no assurance. It's not working. Yeah, now it's working. Okay. Let's start like this, and then I will try to switch for the link mode. For the bigger screen, and I think my colleagues from India asked me if it's possible to do with the big screens, and with these screens on smartphone usually nothing is visible, but okay, let's do it like this. It's a Eurosport mode, huh? Okay, live X-ray live here, reference, and fluoro. Okay, let's do it like this. It's not so comfortable for me, but okay, let's see how it would be. Okay, just a second. Maximum zooming. SAP and lateral in maximum zoom. Okay, I will do Angelo. Stop. Oh, nice. I think it's ACOM artery, yeah? But it's look like. Okay, and the ophthalmic artery is coming from the meningohypophyseal trunk, huh? Yes. Yeah, it's look like ACOM. Okay, let's see on the 2D, and it's better when we have both active screens, and It's inside the aneurysm. Okay. Okay, just a second. We need to go up. Balloon. Then we can push it. No, it's okay. Okay. Need to push it. Goes to the MC territory. Okay. Now it's in the ICA Aneurysm. It's choroidal. I think the wire is a little bit damaged, that's why it's behaved like this. As it's a little bit damaged, I think. Okay. Let's try to navigate the scepter till the A1 segment, and then usually it should be okay. Let's place the scepter in A1, and now it should be good. As usual, it will go to the territory which I don't need. Okay, now it's okay. Okay, on lateral we can check the position of the wire. Okay, now it's safe. And then we need to keep our eyes on the ICA, and the part of the balloon is touching the PCOM segment. That's why it's not so comfortable. I think now we are covering the aneurysm segment. It's okay. It's ophthalmic. When you don't need to go to the ophthalmic artery, it exactly goes to the ophthalmic. And this goes exactly to the aneurysm. The headway 17 also goes with the ICA black. It's the second one. It's exactly, it's so-called shipping technique. When you place one instrument, the second just follow your first instrument, and it say bah. Yeah? She do it or no? Okay. Okay, this position is better. It's a 90-degree headway 17. I think this position is better. Okay. Что секс берешь? Что секс за оптиман берешь? Hope it's okay. Yes, it's okay. Yes, nowadays it's a case of 3 flow diverter stands and everything. Okay. Optima 2-де қаншасы бар? 2-де 4. Аша беріңіз 2-де 4. Okay, I have 2 active screens. One is subtracted and the second is unsubtracted. And now we are touching the dome of the aneurysm. I will pull back a little bit my microcatheter. Now I'll try to push my scepter a little bit up. Yes, it's better to push the scepter in the pericallosal, but I think the tip of the ICA is a little bit changed, huh? Okay, I think we are now a bit distal. Okay, let's inflate the balloon. This looks like balloon inflated, but the visibility is worse, huh? It's not so good. I think we can pull a little bit the head away. It's a 3x10 Optima coils. Optima coil, and second coil we asked for 2x4. I think it's okay. The first coil is okay. 2-де 4 таш псер. 2-де 4 таш псер. Alright. Так, бір жарымда бірдеме деген бар ғой деймін де.
Бір жарым тұстан қандай да?
It's a 2x4. It was 2x4. Jittered. On AP and lateral, it looked like nicely packed coil mass, and it just confirm with the angiography. Okay. It's okay. Let's do zero roadmap. It's a 70% of contrast, but visibility is worse, huh? I think there is a place for one more coil, but I don't want to take additional risk. It's a small aneurysm, and if it's necessary in the future, we can place a stent. Huh?
Yes.
Okay. Okay. Let's take the wire. I will take this one. Okay, I think this packing density is okay. a small aneurysm, it will work. As with this fucking density is okay. Now ICA black is coming, and okay, we need to inflate the balloon. Yes, it's all the time better to inflate under zero roadmap. That's better. Okay, let's deflate. Yes, let's deflate and let's see how the aneurysm is look like. Yes, it's okay. I think we need to take just a second. It was the angiography like this. We can take the smart mask for this, and I think we need to put it here, and we need to put it like this. No. My headway is here. And this place. Yes, it's something here. Huh? It's exactly inside the aneurysm. It might go to the picum artery. Yeah? Might go. Okay, let's check the angle again. Complicated. Перчатка вернешь? Yes, the length of the cover is quite short, that's why time to time I need to change my gloves. Okay, let's check the... It's very important to have an assistant. Something like this is better. Okay, it's moved, huh? Look at it. Because of spasm we don't see it, huh? It might be spasm. Yes, it's better to see subtracted and unsubtracted, but from this point we can see only, yes, it's a picum. We don't need to go to the picum territory. Yes, it goes there. Yes, it goes to the picum all the time. Okay, I need to change the angulation. It's straightened as usual. We need over curving. Yes, today was a nice discussion in the Neradic group about the microcatheter shaping. Yes, it's very important. to have a good shape of the microcatheter. And after placing the micro wire inside, we will replace the scepter. Yes, it's a little bit uncomfortable because I need to work without magnified view. Yes, now we are inside the aneurysm. The AP is confirming. AP is more informative than lateral view. Okay. 3/8 деген спираль бере салшы. I'm asking for 3/8 coil. Optimal болады. Yes, we'll place the balloon like this. It's usually okay. We place the wire inside the MCA. Optima 2 деген қандай бар, спираль? Кетер. Optima 2-ның қайсысы бар? 2/4. Хорошо. 2/4 ашып береміз. Optima. We'll treat right side with Optima and left side we will place the microplex. Okay. I hope it will stay inside the aneurysm. The neck is wide and I think it's okay. We'll just take out the roadmap and we know where is the PICOM and it's okay. Now the coil is... Так, 3/1 деген тағы оптима бар ма? Жоқ, 4 болмайды. Болады жаңа 2/4 берер. The first coil was 3/8 Optima. It's a complex, and now 2/4, also complex. 1/4 Optima var mı? Ya biliyoruz. Yok, 1/2'miş. The second is 2/4. And the third coil for this aneurysm we asked for 1.5/3. Yes, Abzal did some changing the anatomy of the coil, but it's okay. Ашер. Так, микроплекс 2/6 бар ма? Соны ашып бере береміз. И отделялкасын ашып тастайсаңыз. Yes, this coil is 1.5/3 Optima and next coil will be 2/6 microplex. And I hope the diverticulum is also will be occluded. Usually it's not need to go to the daughter sac. It's enough to occlude the mother sac. It's a PICOM. Now we are... it's a daughter sac. Okay. Daughter sac is okay. I hope it's a daughter sac. Так, он ашпай жатыр. 3/6 микроплекс бересіңізші? Yes, I think it's daughter sac then picom. Hangi grafiğini koyuyorsun aldığındakız? Review'dan koyuyorsun. Review ülke içiyorsun.
Видео не следите.
Review ülke içiyorsun. Yeah, also blood. Just a second. We need to see the picom artery. It's just underlying. And daughter sac is here, yes?
Yes. So,
And the artery is going a little bit up. Okay. Yes, it's the daughter sac. Так, no optimal, yeah? Okay. Next coil is 3x6. The roadmap is non-informative because of the good PCOM and the flow is coming from the PCA to ICA territory. That's why it's not informative. And now we will orient from that part to this part. Okay. It's a partially calcified aneurysm. It was ruptured and calcified. Okay, it's a microplex. I don't understand. It's not detached, but it's inside the aneurysm. Okay. It's detached. Okay. I think something is changed in microvention terumanero. Huh? It's detaching without orange lights. It's so surprising. Yes, maybe better to place the scepter inside the picom. Let's see. Maybe we'll place scepter inside the picom. I think it's the better option. To then spec these aneurysms. Okay, let's detach again. Oh, now it's okay. Now it's okay. It was a specific effect for the small one. Okay. Okay. Stop. 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 Offside. Smart mask. Okay, I'm asking Abzal to put this smart mask, and now we'll try to go to the picom. I think it's better to go to the picom territory. No. It's not going to the picom. Going to the aneurysm. Okay, now we are in the picom. Okay. It's better to control, to prevent the coil migration. I think it's enough. Huh? just orifice. Okay, I will a little bit increase the radiation to see clearly the position of the balloon. Yes, now we can see clearly the balloon and clearly see the PCA territory. Okay, let's place microplex Berjan тут. Berjan тут microplex пересанша? Yeah. Yes, on the unsubstructed view we can see the balloon inflated, and now we will work. Abzal is trying to retrieve the coil with non-traditional Kazakh manner. Yes, retrieving the microplex coil from the hub is all the time tricky, yeah? It's all the time tricky. Yes, it's possible to place the Leo baby stand in half T manner. This anatomy is quite okay. Now we'll put one more coil. I will take out yes, now the coil is packing at the infundibulum between two aneurysms. Тогда пробежаем до тур пересанши. We detach this coil. Келес пациентті жай әкеле берсін. Бересің. Алынбай жатыр ма? Көтінен сұрыз ба? Айтсы. Мочевой қойысың? It's all the time tricky to take the coil from the hub. Okay. I hope in Terumanero they will change the hub for the coil from the package, and I'm not sure there is a patents for everything. Maybe the hub from Optima or Axiom coils is okay, but Microvention is doing with the own way, yeah? Okay, I will take... My micro catheter went out. Now we need to replace the headway. Okay, it's going to the different direction. Okay, maybe the balloon will help. Small inflation of the balloon. No, I don't think it will work. It's going to the Picum territory. Okay. Let's deflate, and then we can take a yes. Yes, it's the direction of the aneurysm. Now we're inside the aneurysm. Yeah? Yes. the balloon helps to control the direction. It's not going. Not this way. This way. It's ophthalmic artery. Okay. Let's take out the coil. The coil was inside the aneurysm, then removed the coil. Okay, there is a place for one more coil. I think we need to replace the microcatheter. And there is also place in between two sacs. Smart mask. Okay, let's try. Maybe microcatheter pre-shaping is important, but we try to do it in a conventional way. Okay, now we are inside the aneurysm. Let's go. Okay. Be careful. It's there. The balloon, just to identify the peak-on, and now coil is in place. Yes, it's okay. Barbara, third person. I'm asking for one more 1.5 by 4. I will try to place at the level of the neck and between two sacs. Yes, maybe it's a treatment of single flow diverter, but with the working peak-on, it's not all the time so effective. It might fed by peak-on territory. But for the small aneurysms, usually it works. If it not work, then it's possible to come from the posterior to the aneurysm. Okay, we did a zero roadmap. Now we see the coil. Coil is coming. At the level of the neck. Okay, let's inflate the balloon. Yes, balloon is inflated. I'm not sure this coil will fit the aneurysmal part, but it should. I hope it go. Yes, it's okay. Now we can detach. It's a new version of Microplex. Yes, and it's detached. Okay, let's take out the headway. Okay, let's deflate the balloon, and it looks like in between two aneurysms it's still working. Huh? In between two aneurysms it's still working, but I prefer to finish on this stage. Maybe for the smaller aneurysm in near future we can place stent, and now we secured the aneurysms. Yes, it's occluded. In between it's occluded. Now I'm not sure we should go to the small aneurysm. The coils will be unstable. Then we will need the stenting, and it would additional money for the price. Okay, I'll put it here, put it here. Now we'll go to the left side, and let's see the projection for the left side. It's a 79 left, 17 cranial. Okay, let's do it without zoom. Okay, let's do control and draw. It looks like okay. There is a PCOM and everything is okay. ACOM aneurysm is also okay. Let's do it APN lateral in classical, but it's look okay. Кастрата може не ме крепител. As this is a 44 years old and I'm 44 years old, the same age, the same period of time we're born. Yes, PCOM is in place, the aneurysms are occluded. Yes, but with the PCOM aneurysms, sometimes it's important to occlude the PCOM to prevent the growing of the aneurysm. 79 left, 79 left will be 101 right, and 17 cranial will be 17 caudal. Yes? Okay, 17 caudal. Yes. So this projection. Let's push the. Yes, it's inside the ICA. And this is also in the ICA. Okay, now we are in the ICA. It's maximum zoom. Yes, the government will pay us just $12,000, huh? But it's okay. It's better than in many places. I will take out my guiding because of the spasm. And now, okay, we will orient on EP and lateral. Yes, now it's better. We don't need to go to the PCA territory. Touching the choroidal artery, that's why it's a little bit risky. Yeah? Okay, let's place the balloon here, like this, and I hope the headway will go directly to the aneurysm. But usually it's doing the shipping, yeah? Okay, now we're inside the aneurysm. Okay, we're inside the aneurysm. The first coil, I think this 3mm is better. Okay, let's see. It's 287, 478. Yes, 3 by something will be better. Microplex verirsanız 3'te 6, 3'te 8. И сосын 2'de 6 veririz. The first coil, microplex, and the ophthalmic artery is coming from the orifice of the aneurysm, from the neck region, and absent. Take it. It's a microplex, helical coils, 3 by 8, and the second is 2 by 4. Oldu mu? Bitirir. Yes, now we're inside the aneurysm. And yes, I'm working on biplane, and I usually prefer to use both planes. I don't know why, maybe my foot switch is all the time on the biplane mode. Now we're inflating the balloon, and it looks like it's overinflated, huh? I don't see my balloon. Yes, now it looks like we inflated. Balloon is inflated, and it looked like it was not 70% from the beginning. It looked like it's less than 70. Sometimes during the deflation of the balloon, we use a saline, and balloon is trying to aspirate some saline during the deflation. I think it might be one of the problems. And sometimes it's better to put in the contrast when you're trying to aspirate. Ек-4 пересунешь? Ага, да. Ек-4. Микроплекс. The next coil will be, this is 2x6 and next will be 2x4. All of them are on the left side, all of them will be the microplex. Yes, it's very important to properly prepare the balloon, and in many places colleagues are scaring from using the balloon because of this preparation process. When you use single lumen balloon, it's easy, and when you use double lumen balloon, it's a little bit complex because it's very important to fill with first syringe an exact concentration. And this is aneurysm number 3, but it's ball number 4 because on the right PCOM it was 2 parts of the aneurysm. That's why it's looked like 4 additional 1 sac. Yes, this was 2x4. I think now we can a little bit release the microcatheter. And now I will ask for one more 2x4. Tabii, ек-4. Ек-4. I think 2x4 is better. Yes, balloon assist coiling is okay. In more than 85% of cases, the coil mass is stable by the time. It's not all the time needed for the stenting. That's why in 2025 we still use balloon assist coiling. Yeah. Even in wide neck ophthalmic segment aneurysms. But for the right side, second session, we will place a short flow diverter from choroidal segment till the paraclinoid segment. I think the 15 centimeter FD would be ideal. Or we can place Leo plus stent, and ophthalmic artery usually not involved, and it will finish without problem. Okay. Бержавна торта. Бержавна торта. Yes, we're coiling nearly all aneurysms because of the small scare between 2 sessions and between the extubation and the day number 3 after the treatment. That's why I prefer to coil, if it's possible, all coilable aneurysms, and to leave the patient till the next session. Yes, it's quite surprising, the visibility of the balloons today. It's not exact contrast amount for the scepter balloon. I think one more. Bircan, tut. Yes, one more should be okay. Yes, it's happened when you retrieve it in classical way, and then you need to put again inside the hub. It's a crazy package. I don't understand why. Okay, I don't understand why Microvention is designed this hub. It should be some explanation for this hub. Huh? There is no innovation, there is no easiness to use. Okay, I have no answer. Okay, now we are packing the neck region. Okay. It's as usual extra coil. Huh? Just a second. Let's deflate the balloon. No balloon is deflating. The rod map will not work. Maybe for this part we will need a okay. Roadmap. New roadmap. Okay. Okay, I'll push a little bit my headway. Okay, now I will try to compress with the balloon. Now you can see the balloon, huh? Yes. Now it's visible. But on unsubstructed view, it's not visible. And now I need to rotate the headway a little bit. Okay, it's quite distant. Okay. To prevent the complication, I think it's better to finish. Okay, let's see how it will deflate under road map. Yes, balloon is visible, but I don't know why it's visible so poor. I don't know why. Maybe the big screen. Maybe. Okay, let's see. What's it look like? Oh, ophthalmic artery is in place. The aneurysm is occluded. It's okay. Now it's okay, I think. Yes. The small feeling of the neck part, but it's not problem. Okay. Let's unzoom and projection 0. Siz süre koymadınız mı? Madina. Süre koymadınız mı? Yes, Baccarat is on, but the sound is not so active. Yes, now the ophthalmic artery is in place. PCOM is in place and the aneurysm is coiled. ACOM is in place, and I think we can finish this case. I will ask Abzal to do expert CT. And we have additional 2 cases. It's a stenosis cases, eh?
No, both of them aneurysm.
Ah, aneurysm case. Okay, let's see. We have 2 more aneurysm cases. Eh?
Kız sport уже тръгва, не ми. Общи наркоз ಮುಂде съм дърщива.
Да. Yes, it's a nearly 1 centimeter PCOM aneurysm, wide neck on the 90-degree angulation. Leo plus assisted coiling will be okay, I think. And another one is...
Maybe infinitive, maybe...
okay, the last case we'll check the angio. Okay, let's wait for the control CT. Just a second. This case under general anesthesia. Казвам. The colleagues, CT is ready. Brain looks normal. You can see artifacts from the coil mass, but if it's okay, and now we can finish this case and see you in next 30 minutes. Next case under general anesthesia. Patient is carried from the local anesthesia. That's why we will give general, and it will start nearly in 30 minutes. See you. Келес тоже подобше.
Ага.